Welcome to our next lecture, where we are going to explore the framework behind injuries and then talk about strategies to reduce the risk of injuries or re-injury. Now, oftentimes the term injury prevention gets thrown around, and technically we can't prevent injuries. If you do some type of task, you're always going to be at risk of an injury, but there are strategies that we can implement to try to reduce the risk of sustaining an injury. So the primary objectives for this lecture are to be able to differentiate the etiology of acute and chronic injuries, to describe different methods for assessing return to sport readiness, and then to ultimately describe the return to sport continuum. So the two ways to really classify injuries, they can be classified as either acute or chronic. And so when we say an acute injury, this is usually an injury that occurs from a single force, such as a landing, tackling someone, or pivoting. And this can be considered macro trauma, or very high load magnitudes, but very low frequency of loading. Chronic injuries, on the other hand, are going to result from repetitive forces or repeated, such as when you're running, with each step you take, or pitching in baseball, each throw that is performed. And these are going to be the summation of micro traumas leading to injuries. So with your chronic injuries, you're going to have relatively low magnitude with each exposure, but you're going to have much higher frequency of loading. Okay, so you can see in this curve here, it has your acute injuries to the left with high magnitude, low frequency, so they don't happen often. And then your chronic injuries happen frequently, but they have low magnitude, and it's a cumulative effect that loads up to them. There's a framework for injuries that's been put together, and these are really specific to chronic overuse injuries or overuse injuries, but the basic principle can still be applied to acute injuries as well. And so what you have here is this straight line going across. This is going to be some type of tissue, so bone, muscle, tendon. It's capacity level, so how much force or stress it can withstand. What happens is that when you do some type of loading, so it could be a practice session, it can be a competition, this can cause this level of damage that then reduces that tissue's capacity to withstand force. Now, with appropriate amount of recovery time, what you end up seeing is that load capacity will return to baseline, and then it's going to be able to actually exceed baseline and get stronger to help then by that tissue remodeling. Remember that Wolff's Law, so structures will get stronger when they're exposed to stresses that are higher than they're typically used to withstanding to. So what happens is, as long as you allow that adequate time for recovery before you add another training session or another load, which will decrease it and follow kind of this pattern, is going to lead to this increased capacity and make that tissue stronger, reduce the risk of injury. Now, unfortunately, what we see too often is that we enter some training session and we don't have enough recovery time before we enter another training session or competition, which then means that this tissue is already at a lower capacity than it was when we very first started. And now that capacity is going to continue to decrease and decrease if we don't allow appropriate recovery time to happen. So too often we see this with too frequent enough training sessions or competitions. And this really reduces the ability for the tissue to accept the loads, and therefore increases the susceptibility or the risk of becoming injured. So a lot of times athletes, they'll say, oh, yeah, I'll do just about anything other than not doing the activity to try to stay healthy. But oftentimes it is that recovery that's going to be most important. So really, if people don't want to take off time, what can we then do to ultimately reduce the load? And a lot of that's going to tie back into, okay, well, maybe we can reduce the intensity or the duration of these training sessions so that there's not as much load applied. Now, oftentimes there's going to be this injury, re-injury cycle, because sustaining an injury once is one of the strongest risk factors for sustaining a subsequent injury. So what you kind of see here with this injury, re-injury cycle is that at the top here, there's going to be some type of demand that's going to exceed the capacity, whether in an acute or a chronic fashion, which will then lead to an injury or re-injury. When this happens, that structure's capacity is reduced from that injury. And so what's going to happen is, yes, you might do some rehabilitation to try to strengthen it, but ultimately the goal is to return to activity. And if they return to activity and again that demand exceeds the capacity, we're back into that injury status. Okay, so this is where you kind of incorporate that rehab portion of it before returning directly to the activity to then try to reduce the risk of exceeding the limits. That rehab is intended to strengthen the tissue above what it was at baseline to then make it more resilient to stresses. So now let's explore how we can actually monitor the return to sport readiness. With rehabilitation strategies, the goal is to monitor this progress before ultimately clearing the athlete to return to practice and then to competition. And there's a handful of different ways that this can be done. Usually it's going to be an incorporation of subjective measures. So this is the patient reporting their own outcomes. So these patient PROMs or patient reported outcome measures. And these are just kind of how they feel. Do they have fear of doing the task? Do they feel like they've regained their function? Questions like that. You can also do more quantitative measures. So actually measuring their strength, measuring their range of motion, and even having them perform functional tests that are set to kind of mimic what they would experience during practice and competitions. And these can be hop tests, these can be squats. And here you're really looking to try to identify, are there any compensatory movements that are still occurring? Generally speaking, there's this 80% guideline, which says that the performance of the affected limb should not be below 80% that compared to the unaffected limb. And this 80% rule is rather empirical. And so there isn't actually super strong conclusive evidence that this 80% is the most appropriate guideline to use, because there's a concern that maybe the unaffected limb doesn't perform to a high level. And so now if you're comparing the affected limb to the limb that's not necessarily ideal, sure, it may be within 80%, but overall it might actually not still be meeting the necessary requirements. We can also take a look at this nice visualization of the return to sport continuum, which essentially breaks it down into 5 different stages. So you'll have the repair stage, and this is where you're trying to facilitate the normal healing process, followed by the rehab and recovery, and this is going to be focused on restoring what we would consider normal movement patterns. You have reconditioning, which is now going to focus on the skill-specific requirements, such as developing force and tolerating different loads. And that's then followed by performance, where now you're actually going to be transitioning into full practice and competition. And then last, now you're in your preseason and training camp, and this is where the goal is to get you ready for the season and incorporate these strategies to reduce the risk of re-injury. So if we kind of investigate each of these stages individually, let's first start with our repair phase. So here we're trying to facilitate a normal healing process. And while inflammation is actually needed, that's going to be the first signaling that, hey, our body needs to send these nutrients to start to help with the recovery process. Excessive inflammation is a concern and can delay the recovery timeline. And so part of this is we want to minimize or control the swelling. We want to be able to promote pain-free range of motion, so allowing them to move through a range to complete mostly their activities of daily livings, and to have appropriate muscle activation during both open and closed chain exercises. And so during this repair phase, usually what we're going to see is there's going to be very low levels of loading to not continue to overstress that tissue. Just to give you a general timeline of what this repair phase looks like. So within hours of that injury, you're going to see this is where some muscle damage could happen or just damage to the tissue as a whole. And this is where lymphocytes are going to now start to infiltrate that area. Around the 3-day mark, this is where your immune response is kicking in. So those lymphocytes are going to be responsible for kind of initiating this inflammation response, which is needed to start the healing process. And then around the 7 to 10-day mark, this is where you see this degeneration of the damaged tissue, followed by now regeneration of new tissue. So it's starting to remodel. And then around the 14 to 21-day mark, this is where you see kind of the final building and deposition of the new tissues and scar tissue starting to form. Okay, so this is, again, just a general timeline. It's going to vary from person to person, depending on their just their body's response and the severity of the injury. But you're looking for at least 21 days for this muscle damage response. Really, with the repair phase, you don't want to risk the tissue integrity of overloading it too quickly. as kind of the 7 to 10 day mark where you're starting to have that regeneration of the tissue, that's where it's still going to be relatively weak. And so you don't want to expose it to high loads that would increase the risk of re-injury. In the rehabilitation and recovery phase, this is where we're trying to restore the pre-injury movement patterns, or if those were what we considered faulty movement patterns, trying to correct them. This is where it's going to be important to target neuromuscular control. So that interaction between the nerves and the muscles, essentially how we coordinate our muscle activity through the central nervous system. And part of this is going to be, it's going to be important to identify the correct movement, to identify or correct any type of movement compensations. There's also needs to be this association and disassociation within the different limb segments. So being able to sequentially transfer energy among the segments, but also being able to isolate those segments within the sequential progression might be needed to help to rebuild that segment itself. So if you think about like throwing a ball, for example, you're probably going to start relatively simple, where they might just be using their hand and wrist motions, like if they had a shoulder injury. And then you'll gradually progress to include the elbow, the shoulder, the trunk, and the legs. Okay, so you might want to start with isolating the segments, but then working on that sequential transfer of energy. For the reconditioning phase, this is where you're focusing on the skill development. So you want to make sure that you're building up the tolerance to both the force and the loads that the tissue will experience. And so the goal is to expose workloads that kind of replicate the sport requirements, but you're still remaining below that capacity of that tissue. What's really interesting is that over 25% of is over a 25% injury risk reduction for every additional month before returning from ACL injury for soccer players. So I know a lot of times someone tears their ACL, like, oh, I'm going to be back in 6 months. Okay. Some elite athlete was back in 6 months. Well, that 6 months, there's some people that say you should wait up to 2 years before returning from an ACL injury. Now, athletes don't want to do that, but there is evidence that shows that 2-year mark does reduce the risk the most for that re-tear. And so even let's say you are cleared at 6 months, it might still be okay to take a couple more months, as there's evidence that's going to continue to reduce the risk of re-injury. And with these reconditioning phases, you want to use a combination of both quantitative and qualitative analyses. So just some subjective measurements, but then also being able to quantify it is going to give you a more holistic idea of how they are kind of returning to their original state. In the performance phase, so this is going to be the time period between their first return to practice post-injury and the subsequent return to practice the following season. And here you're just trying to reintegrate with their position-specific skills. So a lot of times you'll hear that athletes were in practice, but they were practicing on their own outside of the team activities. Okay, because you kind of want to gradually introduce them into more extreme demands. So eventually they'll be able to join the full participation, but there might be some type of contact restrictions. But then ultimately the goal is to get them to that full participation without restrictions. Okay, time is necessary for this recovery process. Don't consider it inconvenient delay. Okay, if you return before you're fully recovered, you're definitely at a risk of re-injury. And so it's okay to take a little more time just to allow that recovery process to happen. Okay. Really, with this performance phase, you want to elicit the physical inter-athlete contact until they are fully confident and have kind of met all of these quantitative and qualitative criteria before they return without restrictions. And then last, the training camp and preseason phase. So this is where needs to be considerations for off days and practice modifications because you're not in the season. There's usually been a little period of deconditioning here, so they might need a little more time to recover. But it's going to be really important to work on developing your strength and fitness during this time, but then also consider mental and physical readiness. So someone coming back from an injury, they might still have this fear of re-injury, so they might be tentative with their movements, which could then be resulting in compensatory movements. Okay, so there's a lot of times this pain avoidance or fear of re-injury. That's a mental consideration that isn't necessarily captured in just a biomechanical analysis. So how can we actually classify different injury statuses? there is this continuum prescription. I mean, there's lots of different samples available that you can have them perform these different assessments and ultimately say, okay, they passed the power test, they're good to go. So they can return to practice. Now they can return to play. They've passed a conditioning test, they're ready to return to sport, things like this. You can actually track how this injury is progressing to know, okay, they seem to have met these criteria. We're okay with continuing to move through the continuum. There are a bunch of different return to sport sample tests that can be incorporated. Each one kind of assessing a different category. So there's some that are used to analyze just overall movement and core function. This can be using motion capture. It can be using a Y balance test. And then there's also these McGill, Bunkley, and Watkins testings. You can also use different tests to assess muscle strength and endurance. So measuring with dynamometers, force plates, having them do isometric or isokinetic contractions. You can assess their power producing capabilities, looking at jumps and hop tests and even medicine ball toss. And then you can also just look at their general sport conditioning. So VO2 max, having these different aerobic testing. Okay, so lots of different performance categories that should be considered before ultimately clearing someone to return to sport. So that's an overview of injury framework and kind of the rehabilitation process and considerations to make. If you do have any questions or any experience with the rehab process, please feel free to write them down, bring them to class, or post them on the discussion board, and we'll chat about this more when we meet next.